at the base of the handpiece. Now the handpiece is ready to be utilized in the canal. Make sure that you insert the file passively into the canal in the off position and take it down to your sonic working length prior to pushing the pedal and filing to avoid any type of ledging possibilities. You should begin with the number 15 Rispasonic or Shapersonic file. Once you insert the file to your sonic working length, you should be utilizing a simple up and down circumferential motion for about 30 seconds per file. Repeat this step with a number 20 and then a number 25. You want to use a continuous circumferential up and down motion to ensure the shaping and cleansing of all areas of the canal. Also notice the continuous irrigation coming directly from the handpiece, which ensures that all debris in the canal is flushed out and that the lateral canals and tubules are being cleansed. Refinement of the apical 1/3 can now be accomplished by negotiating the curves of the canal using your current technique, whether it's hand, gyro, or a rotary nickel titanium filing system. After you've completed the filing of the apical 1/3, it's time to do a final disinfection. Now, using a syringe, you can inject your sodium hypochlorite or whatever irrigation method you're currently using and introduce the sonic to better disinfect the canals. This can be accomplished by inserting a sonic irrigation file into your Medidenta MM1500 sonic handpiece. These are non-cutting files and are used for the agitation of the sodium hypochlorite or whatever irrigant you're using and may be taken down to your full working length if you desire. Before starting the final disinfection, make sure you turn off the water on your delivery system so it doesn't come out of the spout at the tip of the handpiece. This process can be done for about 1 to 2 minutes. The cavitation action of the sodium hypochlorite allows the solution to discover, open, and debride lateral canals, which otherwise would not be achieved without the acoustic streaming of the sonic. The high-speed bubbling action also safely removes pulp material and bacteria and significantly reduces sterilization time. Implementing this irrigation technique will give you textbook results in less time every time. Now you can fill the canal with Medidenta's tetracycline gutta percha or whatever obturation technique you are currently using.
From a clinical standpoint, we know that most endodontic failure is caused from bacteria within the canal. The irrigation benefits of this handpiece will greatly reduce the chance of post-operative problems due to the sonic cleansing of all the lateral canals and tubules that would otherwise be very difficult to cleanse with just a syringe and irrigant alone. It's all about peace of mind. Endodontics, first and foremost, is all about cleansability and removing bacteria. The Medidenta MM1500 does this, and it's simply a wonderful addition to accomplish this process and allow you to complete your root canal therapy.
Now these days, many clinicians recommend soaking the canal with sodium hypochlorite for 30 to 45 minutes. Now, a recent study in the Journal of Endodontics said that if you will activate that solution of sodium hypochlorite with a sonic file for 2 minutes, you get the same result as if you just soak the canal for 32 minutes with sodium hypochlorite. So if you'd like to increase your clinical success when doing endodontics and have less post-op problems, I recommend adding the MM1500 handpiece to your present armamentarium. You'll be glad you did.
Some dentists are actually trying to do endodontics using their ultrasonic scalers. This really doesn't make a lot of sense.
No, that's really not what that instrument's used for.
No, it's really not. Actually, the ultrasonic scalers, they operate at over 20,000 cycles per second. And at that intensity, it's very difficult to control. You're more prone to perfing the tooth and creating ledges. It really just doesn't work.
Yeah, and you know, there's no question you need to use the right instrument for the right procedure, and that's why we really like the Medidenta Sonic MM1500. It's designed specifically for endo, so the maximum vibration is low. It's only 1,500 cycles per second. The low vibration allows the file to function at a level which you can really easily control and do your root canal safely. This instrument can be used no matter what endo system or technique you're using right now. You can use the MM1500 and improve every single endo case from the first day. There's really just no reason not to try this fantastic instrument, and your first case alone will pay for it. You'll start getting better results and happier patients. So go ahead and give it a try. Endo's a fantastic practice builder, and we love the Medidenta Sonic handpiece. It should be used on every single case. You should do it too.
It makes a lot of sense. You definitely should do it.